Hare Krishna. This is Yogaraj from Bhaktivedanta Hospital and Research Institute. Welcome, one and all, for the today's podcast, which is on Let's Talk Cancer. Bhaktivedanta Hospital and Research Institute is a 300-bedded multi-speciality tertiary care NABH aggregated hospital which is located in Mumbai Mira Road. We offer holistic healthcare services for body, mind, and soul with the advantages of allopathic, Ayurvedic, homeopathy, and alternative medical therapies under one roof. This podcast is under our flagship program titled ISKCON Devotees Healthcare Services, which was launched in the year 2023 at Mayapur, which is ISKCON Leadership Sangha. Till date, through this initiative, we are fortunate to have got the opportunity to serve more than 4,500 devotees globally. This enlightening session is streamed on Hare Krishna TV YouTube channel. We are honored to welcome Dr. Vishnu Agarwal, His Grace Venu Madhav Das, our esteemed consultant and head of the department Oncology. With over 18 plus years of experience, he will be sharing us and will let us delve into the valuable insights on cancer, treatment, and its prevention. So let's begin our today's session. Welcome, sir.
Thank you, Yogaraj, for giving me this opportunity to share my experience in the field of cancer.
Our pleasure, sir.
Let's hope this seminar is useful for the audience.
Yes, sir.
So let's begin.
Sure, sir. Sure. So, what exactly is cancer? Because the cancer word is so dreadful.
Yeah.
So, लोगों में एक वो fear आ जाता है. So, what is exactly cancer and how does it affect the body?
So very important question because many people have a lot of myths about cancer. They think that cancer is some infectious disease. It spreads from one person to other person. It is because of some external things. But actually, if you see, the cancer is our cell becomes abnormal.
Correct.
Our whole body is made up of many cells. They make tissue, and then when this cell becomes abnormal, and this cell grows abnormally, and it grows at a very high speed, and then it forms a lump, and that is called cancer. So difference between a normal lump and a cancerous lump is that this cancerous lump will spread everywhere, whereas normal lump will not spread, it will be localized, and this cancer lump will cause destruction of other parts of the body.
Correct.
So that is actually, it is cancer. It is not some infection, but it is our own body cell which becomes abnormal, and there are many reasons why it become abnormal. We can discuss it. Yeah.
Correct. Right. So, how common is cancer today, and what are the common types of cancer we see?
So see, as we know, every family has some or other cancer patient now.
Right. Yes.
So cancer is increasing day by day. And there are some cancers which are more common. Like if you divide the cancers into males and females, so males have some particular cancers more common. If you see in India, because of tobacco chewing, oral cancer is very
Yes,
common.
correct.
And if you see, 95% of the oral cancer is because of tobacco chewing. So if we can stop tobacco chewing because of by some awareness or by some government programs, then we can wipe out 95% of the oral cancer. So
Correct.
that is one of the most common cancers in India.
Mhm.
Other cancers more common in males are prostate cancer,
Right.
lung cancer, and colorectal cancers.
Okay.
These are very common cancers in males. But if you see in females, there is a total difference. So in the females, the most common cancer is breast cancer, followed by ovarian cancer and uterus cancer. So these are specific to females, and they are very common.
Right.
And these cancers, most of these cancers actually are curable. They can be detected early, and they can be treated fully. So awareness is important.
Awareness is
Yeah.
important. This is really very insightful message what sir has
Yeah.
said. Like creating awareness for the cancer is really very important. So, what are the most common risk factors for developing cancer?
So, as I said, one thing we have to understand: cancer is not one particular like organ. It is limited. It is not limited to one particular organ.
Correct.
Because our whole body is made of cells. So any cell can become abnormal.
Correct.
So anywhere in the body we can get cancer. So the risk factors depend on the organ which is involved. So if we go from top to bottom, so if you see oral cancer, so what is the most common cause of oral cancer? What are the risk factor? 95% is because of tobacco chewing.
Correct.
And then we go down, throat cancer. So throat cancer is caused because of smoking. So smoking is a major risk factor for throat cancer. Now again we go for gastrointestinal cancers like stomach cancers, colorectal cancers. So we get a lot of these kind of patients from the countries where there is more of non-vegetarian diet consumption,
Correct.
especially smoked meat, because that irritates the gut, and
Mhm.
that can lead to long-term cancer. So we get so many patients from outside countries like Arabian countries, and where they have more of these type of cancer, gastrointestinal cancer, because of their dietary habits.
Correct.
So like this. And if you see other cancer like lung cancer, the major risk factor for lung cancer is smoking. So these are the risk factors. Smoking can be active smoking, like the patient is smoking himself or herself, and there can be a passive smoking.
Passive smoking.
The passive smoking is that suppose if there is a father smoking in the house, the child will also get affected. Or if the friend which he is smoking, then the other friend can get affected.
Right.
So smoking is dangerous both actively as well as
Passively.
passively. So these are some of the risk factors. And also environmental risk factors are there, like pollution. When we are exposed to pollution, then
Mhm.
that can cause lung cancers.
Right.
Then dietary habits are very important.
Correct.
Like I also already told, that non-vegetarian diet or smoked meat, all these are very dangerous for colorectal cancers. But otherwise also, like we when we eat outside food, we don't know what chemicals they have mixed in that.
Exactly.
So all these chemicals, preservatives, they can be a potential cause of cancer. These are called carcinogens.
Mhm.
So it is very important to have a proper diet, a proper timing of the diet. So this is very important.
Right. There is a myth basically. Is cancer genetic? If anyone from my house or from anyone from my siblings, if he's having any cancer,
Yeah.
so is it genetic?
So see, so that is again a myth. People think that my family member has cancer, so I'll also get cancer. It
Hmm.
is not like that. It is genetic only in some particular cancers, and that too, not all the cancers are genetic. So if you
Hmm.
see from overall 100% of the cancers, only 5 to 10% cancers are genetic.
Correct.
So, and what are these cancers which are genetic? So very important to understand this also, because we can do the screening of these patients early in their life, so that we
Correct.
can detect, like a breast cancer. So breast cancer, if there are particular genes like BRCA1 and BRCA2 genes are present in the patient, and there is
Hmm.
a family history, like sister is also having breast cancer,
Hmm.
mother is having breast cancer, then definitely there is a risk of breast cancer in the family. And then we should undergo this BRCA1, BRCA2 testing. And if the BRCA1, BRCA2 test is positive, then there is a high risk of the patient to develop breast cancer and ovarian cancers. So
Okay.
many patients, they prefer undergoing prophylactic surgeries for the breast or the ovary. Prophylactic surgery means that they undergo removal of the breast or the ovaries before they can develop into cancer, because there's a
Right.
high risk. But these are very few patients who are BRCA1, BRCA2 positive. So that is genetic. So
Okay.
there are very few cancers with a genetic, like colorectal cancer can sometimes be genetic,
Hmm.
but most of the cancers are not genetic. They are like environmental and like that.
Okay.
Yeah.
Okay. So, what are the early signs or the warning signs of cancer that people should never ignore?
Yeah, so that is very important question, and we would like to focus on each and every cancer, most
Yes.
common cancers,
Yes.
so that everybody is aware. First of all, I would like to say whatever the science I will be telling, these signs may be present in the normal diseases also, like a small disease. So we should not get afraid when we get these signs.
Hmm.
It is not to make you afraid, but we should be aware. So if we see like oral cancer, which is very common, so the sign of most important sign of oral cancer is if there is a ulcer in the mouth which is not healing. Normally, any ulcer in the mouth, we give some medicines and it heals within 7 days or 15
15
days.
days.
But if
Correct.
any ulcer which is increasing in size, it's not healing, then
Hmm.
one should get a test done by the doctor, not neglect, because we can detect it at an early stage.
Correct.
Similarly, like for esophageal cancer, if there is any difficulty in swallowing food, so there may be esophageal food pipe cancer. Then stomach cancer may present as a blood in the vomit. Lung cancer may present in the like when you spit and there is a blood in the spit, or there is a chronic cough
Hmm.
which is not settling.
Hmm.
Again, that can be the sign of a lung cancer. It's like colorectal cancers are there, which can present as alteration in bowel habits. In the sense, patient may have constipation or a prolonged diarrhea, or there is a blood in the stool, or there is a loss of blood, hemoglobin is low. So
Right.
these are some of the signs of colorectal cancers.
Hmm.
And if you see uterus cancer, it can present as a post-menopausal bleeding. Very
Correct.
important when the patient has already finished her menstruation,
Hmm.
and then there is a bleeding after 1 or 2 years,
Hmm.
then we should be aware that maybe a uterus cancer.
Correct,
So
correct,
these are some of the signs and symptoms specific to some cancers.
correct, correct,
Yeah.
right. And also, there is one saying like early detection saves life.
Yeah.
So, what are the screenings that people should be aware of?
Yeah. So that is what it is very important. Early detection. Why early
Right.
detection is important? Because there are two, three reasons why early detection is important. First of all, early detection means you detect the cancer at a stage one.
Mm-hmm.
So at stage one, the treatment is very simple. So there are three modalities of treatment, mainly surgery, chemotherapy, radiation.
Right.
But when you detect it early, even one modality can cure you.
Mm-hmm.
So like a simple surgery can cure you. But if you detect at an advanced stage,
Hmm.
then you may have to undergo all these treatments: surgery, chemotherapy, radiation. So your treatment become more toxic, more
Right.
prolonged.
Correct.
And the most important thing is, if you detect it early, the prognosis is very good. The patient can live a normal life for the whole
The
life
whole
life
life.
So the
Correct.
survival is more than 95 to 100%.
Hmm.
But if you detect at an advanced stage, like second stage, the survival goes on increasing. Like if you detect at a fourth stage, then it is incurable most of the times.
Correct. Right.
So it is very important to detect it early, and there are many screening tests for available for detecting it early. Suppose I talk about the females. So breast cancer. So breast cancer is very much early detectable because it's an external organ. Patient can do breast self examination every month to see if there is any lump in the breast, if there is any changes in the size of the breast, if there is any discharge from the nipple. So these are some of the signs of breast cancer which may be there,
Hmm.
and these signs may be present in the normal breast also. So we should not get panic by seeing this, but we should consult a doctor. So we, for breast cancer, we do mammography. Mammography is done after 50 years of age,
Mm-hmm.
and that can detect breast cancer at an early stage.
Correct.
Similarly, for uterus cancer, we have pap smear. For colorectal cancer, we have endoscopies. And for prostate cancer, we do serum PSA. So in our Bhaktivedant hospital, we have made cancer screening packages.
Hmm.
So for males, there are
Mhm.
different packages, and for females, there are different packages. So
Hmm.
in this package, we do the test which can detect all the common cancers.
Correct.
So we normally advise the patients to undergo these tests after age of 45 to 50 years.
Mm-hmm.
So we can detect these cancers, and once detected, we can definitely treat the cancer,
Absolutely.
and we can cure the cancer. So first thing is important to understand: the cancer is fully curable. Only we should be able to detect them early.
Right. Right.
Yeah.
So, thank you so much, sir. Early detection again, it saves life. So that's a Mahamantra we can say
Yeah.
on the today's podcast. So requesting participants to please check on your screens. We have displayed the banner of ISKCON Devotee Healthcare Services, wherein you can get in touch with us and you can connect with us for all your medical services. So as you see in the screen, we have the contact number. You can connect with us through Ask Bhakti on live chat for all your healthcare needs. Also, you can see the ISKCON Devotee Healthcare Services number 24 by 7, which is a helpline number, and the online chat services also. You can connect with us. So, let's start again, sir.
Yeah.
What are the early signs of breast cancer, and how can someone perform a proper self exam at home?
Yeah, so I just discussed. So, breast cancer is very common. It is the most common cancer in females. So, we should know in detail about the breast cancer.
Yes.
So, see, early signs of breast cancer is that if there is any sort of lump in the breast,
Hmm.
so this lump can be due to many reasons. 90% of these lumps are non-cancerous. That is first thing to understand.
Correct.
But if we are detecting any lump in the breast, we should never neglect it. We should always get the testing done, consult a doctor, and get it ruled out that it is not cancer. So the most common symptom or sign is the any lump in the breast.
Correct.
Other signs of the breast cancer are if there is any change in the breast contour, if there is any discharge from the nipple, especially red color discharge, or if there is any inflammation or the redness of the breast. So
Hmm.
these things should never be neglected, and we should always go for testing for these. So these are the early signs of breast
Correct. Correct.
cancer.
And what is a specific age for a woman wherein they should start getting the mammograms, and how often they should undergo?
Yeah, very important. Mammography is a screening test. It can detect cancer at a first stage when even the patient has not developed lump. So for normal females, the recommendation is that after the age of 45 years, every female should go breast mammogram every year.
Correct.
That is a recommendation. But I would suggest that even if not every year, at least every 2-3 years, one should undergo a breast mammogram. But in high risk patients who have genetic history, the mammography or the sonomammography should start at an early age,
Mm-hmm.
maybe at the 40 years.
Correct.
That is very important.
And what about the lactating mothers? Are
So
they
for
not
lactating
eligible?
mothers, mammography is not indicated.
Mm-hmm.
Mammography is most times indicated for postmenopausal females.
Right.
For lactating mothers, if there is any suspicion, we should do a sonography of the breast.
Okay.
Yeah.
Okay. And how much do the lifestyle or the family history affect a woman's risk of developing breast cancer?
So very important to understand that see, we don't know the exact cause of breast cancer. Even if I tell you the risk factors for breast cancer, you may say that my friend doesn't have any risk factors, still she got the breast cancer.
Correct.
So most of the times it may not be due to some risk factors, but still we should understand what are the risk factors. See, the risk factors are when the patient has more of estrogen hormone in the body, that can increase the risk of breast cancer. So what are the causes of increased estrogen hormone that we should
Yes.
understand?
Yes.
Like lack of breastfeeding, not having children.
Mm-hmm.
So these are the areas which can increase the estrogen hormone in the body. And obesity or the sedentary habit,
Correct.
lack of exercise, lack of yoga, whatever one do, whether it is yoga or exercise, whatever that. But regular physical activity is very important, not only for the breast cancer but otherwise also.
Correct.
So these are the some of the things which are there.
Right. Right. So I'm requesting participants to please drop your queries in the chat box. Uh, One question we have received: what are the treatment options available for breast cancer, and how the treatment plan is decided by the team of oncology
Yeah.
department?
So breast cancer is a very complex treatment plan, because there are many ways in which we can treat the breast cancer depending on the pathology. So first of all, we should understand what are the investigations we normally do for breast
Correct.
cancer.
Yeah.
So first, mammography is just a screening test, but what we do next, suppose we detect any lump in the breast. So first of all, we do a biopsy of that. So
Mhm.
biopsy will tell us whether it is, first of all, whether it is cancer or not. Secondly, which type of cancer, because there are many variables in the breast cancer. We are ERPR positive, Herceptin positive, Herceptin negative, and each type the treatment plan will depend on what type it is.
Mhm.
So first of all, biopsy we do, and then we do PET scan. PET scan is a whole body PET scan which will detect whether cancer is spread to other organs or not.
Mhm.
So because on that also it depends the treatment plan. So if the patient is detected at an early stage and if there is a good biology, then we go for surgery first. So
Okay.
surgery, normally earlier there was a breast removal which was being done, but now there is no need to remove the breast. If the disease is localized to one component of the breast, then we can do a just an excision of that lump and the excision of some lymph nodes from the axilla, which is the draining lymph nodes for that lump.
Correct.
So that is called breast conservation surgery. We can conserve the breast, and there is no difference in the survival whether you remove the whole breast or you preserve the breast. There is no difference. So there should not be any myth that, oh, I will get the breast removed, then I will be cured. It's not like that. We can conserve the breast, and then also the treatment, the survival remains the same. Okay, and then once we remove the breast, remove the lump, and then we send it for testing, and then we come to know whether we need chemotherapy or we need radiation or any other additional treatment is required. And in many cases, when there is another biology, the we may have to give first chemotherapy also, reduce the size of the disease, and then we go for surgery, and then we go for chemotherapy, radiation, depending on the, it's all depends on the staging of the cancer and biopsy characteristics of the cancer.
Correct. Right. So regarding staging only, we have got one question.
Yeah.
What are the treatment options if caught early versus late stage?
So that is what I explained. If we are early cancer, we can just do a surgery. If it is very early, even in surgery and some hormonal tablets, that's all. We don't need chemotherapy, radiation.
Okay.
When it is ERPR positive cancer, if it is in mid, so patient may require surgery first and then chemotherapy, radiation, or if it is Herceptin positive, then maybe chemotherapy first. So it depends on the biopsy.
Correct.
And if it is in late stage, like if it is in fourth stage where it is already spread, then most of the treatment it is done by the systemic treatment, like only chemotherapy. and there is hardly any role of surgery, because even if you remove the breast, it doesn't change the survival. So we go for chemotherapy and targeted therapies in that.
Correct, correct, right. So let's move on to the next
Yeah.
cancer, ovarian cancer.
Yeah.
So, what are the early symptoms of ovarian cancer, and why is it often diagnosed at later stage?
Yes. So, why we could diagnose breast cancer early? Because it is an external organ, whereas ovary is an internal organ. It is
Correct.
inside the abdominal cavity. So we don't detect. There are no signs and symptoms which come at an early stage. So when the signs and symptoms come, it's already stage 3. Like patient develop a lump in the big ovarian mass, and there
Correct.
is an fluid which is filled inside the abdominal cavity because of the ovarian cancer. Then only the patient comes to us many times, until or unless they are incidentally detected because of sonography done for some other reason.
Right.
Some gynecologist has done some test, and then they come at an early stage also.
Mhm.
But most of them come at early late stage, and they come with bloating of the abdomen, pain of the abdomen, like that.
Correct,
Yeah.
correct, right. So again, here the awareness and the vigilance
Awareness,
needs to
yeah.
be created.
So if we do screening for these kind of patient, like after 45 we do a regular sonography, then we can detect even ovarian cancer at an early stage. So that is why our cancer screening packages are very important. For after the age of 45 we do regularly sonography and all these tumor markers.
Right, correct.
Yeah.
So is the reliable source of screening will be sonography, or PET scan also be
No,
done?
sonography only. There is no need of
Okay,
PET scan for screening. PET scan is
okay.
for staging.
Hmm.
Yeah.
And what are the treatment options available for ovarian cancer?
So again, the treatment is all divided into three parts: surgery, chemotherapy, and then targeted therapy. And ovarian cancer. So if it is early stage, then we directly go for surgery, removal of the ovaries and the lymph nodes and other uterus. But if it is an advanced stage, then first we give chemotherapy, downstage the disease, and then we go for surgery and remove the ovaries and the uterus and the lymph nodes,
So
like that.
again, it's a myth. Ovarian cancer detects after the menopause, or how it
So
is?
ovarian cancer is most common after menopause only, but it
Okay,
can be in
detected
the
early.
early also. Yeah.
Okay, okay, fine. Uh, let's begin for the uterus cancer now. So, what are the common symptoms of uterus cancer that women should watch out for?
Yeah, so uterus cancer is again a very common cancer in females, and in urban females, it is now becoming more common endometrial cancers,
Correct.
like uterine cavity cancers. So the most common symptom of uterus cancer is that it can happen in premenopausal females also, but
Hmm.
most of the times it happens postmenopausal females.
Correct.
So when there is a postmenopausal bleeding, like the patient has already completed menstruation, she's already in 50s,
Hmm.
and then she suddenly starts bleeding. So that is very important sign,
Correct.
and we should not neglect that bleeding at all,
Hmm.
because 10% of the times it is because of the endometrial cancer
Right.
or cervical cancers, which is
Correct.
the part of the uterus. So the postmenopausal bleeding is the most specific sign for endometrial cancer, and we should not neglect it.
So, is there any hormone therapy for this?
No, there is no
There is
hormone.
no hormone
No,
therapy for
no.
this. Okay. And the risk factors for developing the uterus cancer would be?
So risk factors, again the same risk factors which I told you about the breast cancer. So excessive exposure to estrogen causes
Again, the
increase,
same.
like obesity and lack of breastfeeding and nulliparity,
Hmm.
and all these factors again are the risk factors for uterine cancers.
Correct, right.
So basically, this obesity and nowadays is increasing in the females, in the urban females. So that is causing more ovarian cancers, uterus cancer. So physical activity is very important for females.
True.
So we should understand that how important is this physical activity.
Correct, right.
Yeah.
So, we have one question from the listener. After third stage colon cancer treatment,
Mhm.
patient needs to go multiple times for toilet.
Okay.
Is there any treatment to control it? Please let us know.
Rectal cancer.
Yes,
Yeah.
colon cancer.
Yeah, it is like, see, what is the function of the colon and rectum? That is very important to understand. It is like a storage organ.
Hmm.
Especially rectum and the sigmoid colon, they are a storage organ. So once we remove the rectum, part of the rectum, then our storage organ is gone. So whatever comes, it has to go out, because
Correct.
there is no storage. So for that, what we do, there are some medicines, Ayurvedic medicines also, are the isabgol we can take, and then there are some medicines to control the frequency of motion, but it depends. If the frequency is very high, then we can take some anti-motility medicines.
Correct.
But if it is not so high, if it is like 4 or 5 in a day, I think we should just get used to it, because if we try to stop the motions, then it can cause constipation and other problems. So normally I don't advise so much of anti-motility drugs until unless the patient is very this.
Okay, right. And how does this colorectal cancer, colon cancer,
Hmm.
does it starts from polyps in the colon, or how does it?
Yeah, so most of the colon cancers start from as a polyp only,
Okay.
and they start as a polyp, and the polyp is there for years together before it develops into cancer.
Hmm.
So again, this is very important, because in Western countries, the screening for colorectal cancer is very common.
Correct.
It starts at the age of 45 to 50 years,
Right.
and every 5 years, all the normal people undergo colonoscopy to see. That is why when I was in Korea for training in colorectal cancer, that
Right.
time I used to see that 50-60 patients undergoing colonoscopy every day, because
Oh,
normal, and they are detecting colorectal cancers at a very early stage, like first stage, and they're
correct.
fully cured. So it's, yeah, it starts as a polyp, and it goes for many years before it becomes cancer. So we can detect cancer, this polyp, at an early stage and get rid of it,
Correct.
and
Correct.
can prevent the colorectal cancers.
Right. True.
Mm.
So again, requesting our participants who had joined us, you can just have a look at your screen. We have displayed the ISKCON Devotee Services banner, wherein the contact numbers have been mentioned on the banner itself. You can get in touch with us and you can avail the services for Bhaktivedanta Hospital. So the offerings are like special health talks and webinars, the interactive sessions for the devotees on the various health topics. You can also see the contact number, which is a helpline number for ISKCON community, which can be used to book an appointment on priority basis, felicitate the emergency or any other queries. And also you can come to our bot services, wherein you can ask Bhakti for any care of your medical needs. So again, sir, what are the common symptoms that might indicate colorectal cancer?
So, the colorectal cancer, the common symptom is like altered bowel habits. That is the most common symptom.
Okay.
So, when the cancer is in the rectum, so it can obstruct the rectum. So, patient may not pass the stool for many days, or sometimes they are able to pass very minimal stools, and that is in the form of diarrhea. So, this alternate diarrhea with constipation, that is one of the symptom. Second symptom is that there may be a bleeding from the stool, like stools may be black. So, that is
Okay.
another symptom.
Okay.
Thirdly, sometimes they are diagnosed. Suppose patient is having anemia and we don't know what it is, and we do CT scan or colonoscopy, we find a cancer in the colon because he is bleeding from the colon cancer.
Correct.
So these are some of the symptoms of colon cancer, early symptoms.
Right.
Yeah.
Correct. So typically we say like the starting age of the detection of the colon cancer is nearly around 40 to 45 to 50.
Yeah.
So what are the different types of the screening test we should undergo apart colonoscopy?
Yes, see, colonoscopy is the best test for screening colorectal cancers, because you
Correct.
can visualize everything inside the colon.
Right.
Rest of the tests are like occult stool blood test is there,
Mhm.
then CT scans are there, but these tests can miss the colorectal cancers. Even the tumor markers are there, like CEA, but they again can miss. So the best test for screening colorectal cancers is colonoscopy. And if there is a family history of colorectal cancers there, and it's like a Lynch syndrome is there, in which they should start early age also, like by the age of 40 years they should start screening.
Correct. Right.
Yeah.
So one question again from the listener. Uh, what is the inflammatory bowel disease? Can you throw some insights about it?
See, there are two types of inflammatory bowel disease, like Crohn's disease and ulcerative colitis. So these are the disease in which there are ulcers throughout the colon, and it is there for many years, and sometimes it develops into cancer. So I had one patient who had this ulcerative colitis since 20 years. He was on some ayurvedic medications, was regular on follow up, but after 20 years he developed cancer in that and we operated him. So yeah, these are the diseases which are a risk factors for colorectal cancer. So one should be very vigilant, and one should do a regular screening, and if it is cause of concern, then we should undergo a treatment and surgical removal of the colon. So we may have to undergo the whole removal of the colon and join the small intestine to the rectum directly.
Correct. So
Yeah.
for this also again the chemotherapy, radiation,
No,
or
no,
any
this is a
more?
benign disease. This is not cancer.
Okay,
The inflammatory bowel disease, there are different medications for them
correct.
to be controlled, but they can develop into cancer. So it's
Okay,
very important to be aware and to be vigilant about that.
correct, correct. True, sir. We'll take the next question, sir. Please tell us symptoms and causes of skin cancer and blood cancer.
Okay. So see, skin cancer is not very common in India. It's more common in Western countries which have fair skin and they have exposure to sun.
Mm-hmm.
So the symptom is very typical. Like skin is an external organ again, so it is very
Correct.
easy to understand. So if there is any ulcer in the skin or if there is any patch in the skin, which is if there is a well-defined patch, then less likely of cancer. If
Mm-hmm.
there is a ill-defined patch, heterogeneous patch, and there are like different colors, and this patch is increasing in size, so these are some of the signs. If there is any bleeding discharge from the patch, so these may be some of the signs of skin cancer. So whenever these symptoms are there, one should get either biopsy, at least consultation done. Yeah,
Okay.
another type, which
Blood
blood
cancer.
cancer. Yeah. So again, blood cancer is not very common in adults. It is more common in children,
Mm-hmm.
and many times it is not detected for many days. But how we get detected? Because blood cancer, there is no external symptom in the initial stages. So
Correct.
sometimes we do a CBC for some other purpose,
Mm-hmm.
like patient has got fever or something, and then we detect blood cancer. Oh, this counts are very high or platelets are very high. These are the, and sometimes there are symptoms like chronic fever is there, loss of appetite are there. So
Correct.
these are some of the like things.
Correct. Correct.
Yeah.
So, again, the different type of cancers, as you mentioned earlier in our talks, that
Yeah.
is oral and lung cancer.
Yeah.
So, what are the preventive measures would you recommend for individuals living in the urban areas with high population levels?
So there are many factors which can cause cancer, like oral cancer. I told you that it's a tobacco
Yes,
chewing,
correct.
so we can prevent oral cancers. Then smoking,
Mm-hmm.
again it is a very high risk. So lung cancer and throat cancer and all this. Then alcohol intake is a cause of liver cancer. Then diet is very important. So
Actually,
diet, I told you that most of the colorectal cancers, gastrointestinal cancers, it is because of the high fat diet intake. High fat diet, mostly non-vegetarian diet,
correct.
like smoked meat. So we should take simple food, more of fruits and vegetables. It has been shown in the study that more of fruits and vegetables in the diet decreases the chances of cancer.
Correct.
So that is very important. Physical activity is very important.
Mm-hmm.
So regular physical activity decreases the chances of breast cancer, ovarian cancers, uterus cancer, even colon cancer. So this is very important. Maintaining a proper weight, that is
Mm-hmm.
important. And yeah, although there is no direct correlation, but it has been shown that proper sleep,
Correct.
very
The sleeping
important.
patterns.
Stress free life, that again decreases the chances of cancer.
Mm-hmm.
And I would recommend everybody should at least go some time to fresh air every day, so that their lungs can get a pure oxygen.
Right.
Pure, it's not available. Whatever fresh oxygen we can get, so that is again can prevent the chances of cancer. Although I'm not saying that even after doing all these things one may get, the chances will reduce.
Right.
Yeah,
Correct.
that is important.
Correct. Right. And as you earlier said, so the symptoms like it starts from a simple ulcer
Yeah.
from the oral, or when we spit, when the
Yeah.
blood comes from the
Yeah.
sputum. So again, it's a lung cancer. So what is a kind of thing which you need to mention to our devotees, or maybe the general public should be aware of?
See, for devotees, actually, many things are already being followed by the devotees. Like they don't eat non-vegetarian diet, they
Correct.
don't smoke, they don't drink alcohol. So many things. So most of these cancers, like oral cancers, they don't happen to devotees most of the
Devotees.
times, like
Mm-hmm.
lung cancer. So for devotees, what I would like to say is, first of all, they should make their schedule in such a way that they give importance to physical activity.
Absolutely.
Regular, I am not just talking about cancer in this particular. So I am saying this, because physical activity not only reduces the chances of cancer, but it reduces the chances of other diseases like heart disease,
Right.
diabetes, blood pressure. So if we can some give dovetail some time of our day
Hmm.
to physical activity is very important. Secondly, devotees should also have more like dietary in the sense factor also they should take into account. They should not be eating a lot of sugars, that is what
The oily food.
oily foods, so that again can cause many diseases. See, most of these diseases, we are now talking about cancer, but if you see, the root of all disease is the same.
Same.
Whether it is
Absolutely.
cancer, whether it is heart attack, whether it is blood pressure, the root is same, like some inflammation in the body. So why it happens? Because of the bad food, not proper sleep. So what happens that our body gets irritated, our cells get irritated because we
Right.
are not giving proper things to the cells.
Hmm.
So these cells then revolt, actually, like we say action is equal to reaction. So these
Correct.
cells revolt and they become abnormal.
Right.
So they, when they become abnormal, they may become cancerous, or they may develop into the heart blocks. So we should be aware of all these things, and
Correct.
we should, like,
True. One of the participant has again asked the question like, is blood cancer curable?
yes, blood cancer is curable. Like 40 to 50% of the times, blood cancer is curable. Not all blood cancers are curable, and sometimes even if it is cured, then sometimes it can relapse also. So we have to be very vigilant about that also. So yeah, there are blood cancer which are curable, not all.
Correct.
Yeah.
Right. So let's speak about some for the families or the caregivers. How can family members and caregivers best support a cancer treatment, both medically and spiritually?
Yeah. See, word cancer is very dangerous, you know. Once anybody hears cancer word, even if we tell them, if the patient comes to us, and if
Absolutely.
we counsel them, don't worry, it is a very early stage, you will get cured, but still it haunts them like anything. So
True.
first of the important thing is the emotional support to the, we should
Absolutely.
not neglect those patients in our family with cancer, whoever they may be, they need emotional support. That is the most important thing, counseling,
Hmm.
and they should understand that somebody is there to take care of them. That is
Absolutely.
very very important that is the family front. And spiritual front, like, very important. Like, we have done studies in our hospital, Bhakti Vedanta hospital, that when we give spiritual care, then the healing increases, and they get healed better, and they recover much better. We have already proven in this study
Yes.
that so it is important. Spiritual is also important, and emotional support important, plus financial support is very important, because the cancer treatment is very costly. So we should try to support them, our family members, whatever.
Right.
Very
Correct.
important.
And what will be the coping mechanisms would you suggest for the families who are really struggling with their loved ones who have diagnosed with cancer?
Yeah. So first of all thing, we should come out of the myth of cancer. Like, I have now I'm practicing since 18 years. So I have my patients following up with me since 15 years, 18 years also, who have I operated earlier. So first of all, we should understand that cancer is curable. First thing is very important, cancer is curable, we should be positive about it. And nowadays the treatment is such good that we
Hmm.
can completely cure. So that is, one should understand, we should not just get afraid or frightened by listening the word cancer.
Right.
We should know what is the proper stage, and what are the treatment availables, and then we should go ahead with the treatment, and you will come out of it. And many patients are surviving now with the cancer fully cured.
Fully cured.
So
Correct.
nothing to worry about that.
One question, sir, from the listener: does cancer affect the mental and emotional well-being?
Of course,
Again, the
once
same.
I've already discussed that cancer word itself is so dangerous to hear,
Yes.
actually. So,
Correct.
but we
Correct.
should understand. We should not be. Yeah, it is very difficult to understand, but try to understand that what is the stage, and whether it is curable or. So most of the cancers are curable. Yeah.
Correct. Right. So, again, could you just give us a light on which clarifies the guidelines on screening first, secondly, reduces the confusion, and promotes the early detection in cancer?
Yeah, so very important. See, screening is very important. As I already discussed, we have discussed about the
Yes.
breast cancer, uterus cancer, and ovarian cancers, colorectal cancers. So all these cancers can be completely cured
Hmm.
if we can detect them at an early stage.
Correct.
And the second thing is, many times there is a fear. Actually, I have seen many patients actually who were detected with the breast lump, and they just neglected it, and then they even didn't tell their family members,
Mhm.
and then they presented after 6 months with a large breast tumor which is already spread.
Correct.
So that thing we have to remove from the society, the fear. We should understand that cancer is curable
Correct.
if detected early.
Mm-hmm.
Whatever, like whatever cancers, so all they can be easily cured, but we should not neglect the treatment
Correct.
because of any reasons. That is
Right,
the
right. True, true. Absolutely. And at our Bhaktivedanta hospital,
Mm.
we do have the treatment options available, also the surgical part, the chemotherapy, the mammograms, the PET CT, and recently we'll be also coming up with the MRI facility as well at our Bhaktivedanta hospital in Mumbai
So
Mira Road.
presently we have everything for the cancer. We are now
Under
full-fledged
one roof.
cancer center. We have from the radiation, from the chemotherapy, from the surgical point of view. So we have the whole full-fledged cancer center, and the good thing is that we have support systems also, where if the patient is financially poor, we support the patients financially also. So we have all the facilities available.
Correct, right. Again, one myth, sir. People are very much into this thing, radiation
Hmm.
chemotherapy, that will also again damage the other organs.
Yeah.
So again, that's a myth.
Yeah.
Would you throw some light
Yeah,
on
yeah,
that?
yeah. See, definitely there are side effects with chemotherapy.
Right,
There are
correct.
side effects with radiation
Yes.
and surgery. So, first of all, I will talk to, because I am a surgeon, I will talk about surgery.
Yes.
So, see, earlier the surgery which was being done was a traditional open conventional surgery where we have to used to open the whole abdomen to remove the tumor. But
Yes.
now, with the advance in technology, we are doing minimal invasive surgery like
Mhm.
laparoscopic, or now it's robotic surgery we are doing.
Yes.
So, for what happens that we just make 3 4 holes, small holes, 5 millimeter holes or 10 millimeter holes, and we remove the tumor. And just for the removing of the tumor, we take 4 5 centimeter incision.
Mhm.
And previously the incisions were 20 centimeter, 25 centimeters, so the recovery is very fast. Our patients now go home within 2 3 days, and they
Yes.
don't need ICU
Absolutely.
stay. So that has got the advance we have made in surgical. So the side effects have reduced. Previously patients were staying in ICU, a lot of pain was there, but now it's like a painless recovery they are having. This is surgery part. So, and now coming to chemotherapy, definitely
Yes.
there are side effects with chemotherapy, but there are medicines to control those side effects. And the counseling is also required, and we can get away. And radiation again has some side effects, but again it can be countered.
So, are there any newer targeted therapies which have come into the
uh,
new inventions or medical sciences?
yeah, so now there is a lot of advancement which has taken place. So we have targeted therapy in many organs, cancers, like you name that. Everywhere there is a targeted therapy, there is immunotherapy. The advantage of these targeted therapies and immunotherapies is that they don't damage other cells of the body most of the times, so they
Mm-hmm.
target the specific tumor only. So
Correct.
that is an advantage. Like if you have heard, like we got a news, some patients with rectal cancer in US got cured with some
Yes.
immunotherapy.
Correct.
So there was a news that now cancer is curable,
Mhm.
but it was specific to rectal cancer and is specific to certain genetics of that rectal cancer. So we have to do a gene testing for
Correct.
that patient. If that gene is positive, if that gene which is causing cancer is present, then
Mhm.
only we can target that gene.
Correct.
That it's not that every colorectal cancer can be cured by immunotherapy. So
Absolutely.
certain factors are there.
Right. Right.
So that we have to go into that.
Correct. Right.
Yeah.
Right. So, in today's podcast, basically the mantra is early detection saves life.
Yeah.
And Sir has rightly detected that there is no specific age wherein you can go ahead and you can do your cancer screening. Even at Bhaktivedanta Hospital, we do have cancer screening packages wherein you can come to us and you can avail the services and get the packages. So thank you so much,
Thank
sir,
you.
for joining us in today's podcast.
Thank
I
you.
also really thank to our participants who have joined us in the today's podcast. We will get back to you and see you soon in the next podcast with some another health topic with the another consultant. So till then, just take care of yourself and take care of your family.
Thank
Hare
you.
Krishna.
Hare Krishna. Thank you.